I think I always knew that I wanted to do medicine because I was always, exposed to it, and not for good reasons. I was very sick as a child. I had asthma, so always, in the hospital, and that was my first exposure to everything.
Hello, welcome to the channel. My name is Dr. Ojevwe. I'm a functional women's medicine practitioner based in Rochester, New York. And today we are in for a treat. I have Dr. Ojevwe with us. She's a family medicine physician, board certified. She attended medical school at SUNY Upstate and did a family residency in Penn State. And she's going to be talking to us about primary care and the current terrain and how you can navigate the current system in a way that is equitable. As you know, I'm always about longevity. I'm always about how we can take better care of ourselves as women. So without much ado, I would like to welcome Dr. Ojevwe. Can you please introduce yourself to the audience? Tell us about yourself, and then we'll carry on with the conversation.
Sure. Thank you so much, Dr. Ruth. Thanks for having me. It's such a pleasure being here with you and chatting today. So, hi everyone. I am Dr. Cindy Ojevwe. Like Dr. Ruth said, I am a family practice physician, board certified in family medicine. I went to SUNY Upstate in Syracuse, which is nearby. Dr. Ruth, she's in Rochester. But did med school at SUNY Upstate in Syracuse and completed a family medicine residency with Penn State in Pennsylvania. That's where I currently practice. I have my own private practice. We just opened. We are now a hybrid practice, meaning we take insurance and we do what's called direct primary care, which is one of the newer models of care where it's by a membership model, and you provide care. Patients get direct access to their physician. So happy to be here with you guys. Happy to chat with you, Dr. Ruth. Thanks again for having me.
Yeah, so thank you for that generous introduction. So take us back to when you decided you wanted to be a doctor. What drew you to medicine? Yeah.
Sure. So we're going all the way back, huh?
Yes,
so
we want to go all the way back. Yes.
So I'm actually, I know my last name is it sounds Nigerian, but I was actually born in the Caribbean, tiny island called St. Lucia. Growing up there, I think I always knew that I wanted to do medicine because I was always, exposed to it, and not for good reasons. I was very sick as a child. I had asthma, so always, in the hospital, and that was my first exposure to everything. I can't tell you like a specific time that I knew, oh, this is what I'm going to do. But once we moved to the US, I was age 14. I just remember that always being my goal. I have to get into med school. I wouldn't say there was a specific point, but it was just something that I knew. I knew I wanted to help people. I knew I had that ability. It's almost like a knowing and a calling. Mm-hmm. And I use, my gifts and my talents to do that. So that's where we started. Unfortunately, things happened and I was able to get into medical school.
That's amazing. Thank you. It's always something that sparks your interest. And, sometimes some people have a specific time and moment where the stars aligned and they knew I'm going to become a doctor. And for some of us, it is a process of or a deep sense of knowing within yourself that this is what I am here. This is my purpose. This is what I'm meant to do here on earth. And it's just amazing how God opens the doors and makes room, and all those things come into alignment. And then one day you wake up and you're a doctor.
Yes.
And well,
Well,
maybe you don't wake up.
one day we
then
wake
be-
up, the 4 years and the years of, but yes, sorry.
Yeah, you spend your 20s in the library and miss half of your 30s, and then
Yes.
you get that badge of honor, and now you're a doctor. And then what made you decide on family medicine specifically?
Sure. So when I graduated med school, I actually matched to pathology. So at the
okay.
time, I know, right? At the time, I was married. I had our son in med school. I had him after my second year of med school. And my partner at the time was also in medicine, and life at home was just like very busy, very busy. And I felt like when I was picking a specialty, I needed a specialty that would allow me to be a wife, a mom, and not be as tired. So selfishly, I picked the specialty of pathology, thinking, it would be more like a 9 to 5 job, more or less in medicine, guys, when
Yeah.
you're,
There's no thing as
right. So I thought that would be more conducive to me having a life outside of medicine. I actually matched to the Hershey Med Center, again with Penn State. After med school, did a year of pathology, and towards the mid-year, I realized like, this is not for me. Pathology is not my gig. That was not why I went into medicine. Again, going back to like that purpose and calling and knowing like, okay, is this really what I was meant to do? In spite of it being a more manageable schedule. So I think it was around December of 2017 that I was like, okay, no, this is not working. And I decided to re-enter the match. And fortunately, I switched to family medicine, which was more of what aligned with, my desire of being a doctor. Like I wanted to talk to patients. I wanted to see a range of ages, like from, as we say it, from the cradle to the grave. I wanted, help people be better with like their chronic medical conditions. When I had done my family medicine rotation in med school, I really, really loved it. I had actually spent a lot of time with a private practice physician at the time, not knowing that I would be going into private practice. And again, just looking back at like how your steps are ordered, even when you're not really thinking of it, because often I think back to him and, like the little nuggets he would drop here and there while we were working together. But that rotation, I remember struggling with, wow, I really like this rotation. But at the time, really choosing something else for what I now consider selfish reasons. Yeah.
Okay, I see. So you were drawn to it. I think a lot of us who are we were served by community doctors, if you will. Like, I was born and raised in Ghana. And so I think a lot of us get drawn to family medicine because that's the picture of medicine that we become more acquainted with. We don't typically get exposed to the surgical stuff and other esoteric stuff. We are more of like the family doctor and all of that. So that's pretty amazing that you didn't end up spending the 4 or 3 years only to realize this wasn't for you.
Yes. And it's the lesson in that for me. It's never too late to course correct. It's never too late.
Exactly.
Always. Yeah.
Exactly. Exactly. And it's great because your patients are going to benefit as a result of you realizing isn't for you, although this is the lifestyle you wanted. This is not what is in your books, if you will. So that's really wonderful. So take us to where you finally earned that last badge of honor. You are an attending or the attendee of the attendings. You have a longer white coat now.
That's what we look forward to.
Yeah, it's that's the goal. So tell us what happens at that point, because I know you just started the private practice. So you were in practice in the hospital setting, if I remember correctly. And then you made this turn of wanting to be in the private setting. So what made you make that move or,
Sure.
turn? Yeah.
Sure. So I graduated the residency 2021. And that's when you get your long white coat. I was working for a major hospital system, and I worked for that hospital system, I would say from 2021 to 2025, so about 4 years, but in different roles. So when I first started with them, I was a primary care physician, meaning like I would see patients 4 or 5 times a week, like in the office setting. Got really burnt out with that, and I was commuting quite a bit there. And then what the I guess the hidden part of being a doctor that a lot of patients don't know about is all the behind the scenes things we do. So, they're sending messages and we have to respond to those messages. And if you have a panel of patients, of thousands of patients, and you're getting all those messages, after you see the patient in the clinic, you write your notes, you still have, to answer messages and take care of them, what we call asynchronously. So all of that was happening behind the scene, and sometimes it can take a toll on you, where you're responding to messages while you're on vacation, that kind of thing.
Yeah.
It can be really tough. So I decided to make a switch to hospital medicine, thinking again that it would be better. I'd get to actually see my kids. I'd actually probably get to sleep. I'm just kidding, but I mean. More or less kidding. But I wanted that 1 week on, 1 week off schedule where, like when I'm working, I'm really working. And then when I'm off, I'm off. Or at least so I thought. So switch to hospital medicine, which is where you do rounding. Sometimes for us at the time, it was about 12 hours a day, right? For 7 days. And of course, there are days you don't really leave after that 12-hour shift. Like if a patient is crashing, of course, you're going to stay until, you can hand that off. But even though it was a week on, week off schedule, I was still feeling like, okay, this is a bit too much. And I don't think that this is how medicine was designed to be done. This is not how I can best serve my patients. And who's to blame? Partially myself too, because even on my weeks off, I would be working as an urgent care physician, helping out, doing it to myself, right? So the burnout was real. So in answering your question, after residency, I have worked as a primary care physician, I worked as a hospitalist, I worked as an urgent care physician. And then just came to the realization, like, okay, this is too much, Cindy. You're going to kill yourself if you continue like this. I always knew that I wanted my, private practice. I came across a podcast called the EntreMD podcast. I think you're familiar with it.
Yeah.
I had a mentioned that, like on my way to work, I had those long commutes, and I was just listening to that podcast. And I think it was a combination of things, me being like really tired, me realizing like, okay, I know I'm on this path, I have this calling, but I'm not doing it the way I feel like it should be done. And then listening to this podcast and someone is telling you like, yes, it can be done. It can be done. So it was a combination of things, and I just decided to take the leap, July of 2025, and open my own private practice.
Yeah, that's amazing. Congratulations. I think that the lure of hospital medicine can sometimes it's good in terms of that work-life balance where you can leave work at work when you're home, but it also does not satisfy that need sometimes of why you went into medicine, because it's the forming of relationship, and for you from cradle to the grave, and for having those strong relationships with your patients is the driving force when it comes to what doctors want to be and why we went into medicine. And I can also see how practicing in a private setting within a big system and basically having a large panel of patients that you are responsible for can also make that dream of, I really want to care for my patients. I want to spend time with them. I want to actually help them, feel better. It becomes challenging when you have 15 minutes per patient. And, and if you are like most of our patients, that's like just scratching the surface, and always feeling rushed. Would you like to take us to a day like that, and how you think it's different now that you are in private practice, like the differences that you are seeing, and just how hopeful you are with the new setting that you have?
Absolutely. So I think a huge part of the problem with the whole healthcare system is just how it's built, right? So we have insurance companies, they're dictating a lot of, how we do things. So a lot of it is insurance run, and I won't get into that too much. But you mentioned like, okay, in certain systems, it's about seeing the most patients to get paid, right? So the number of patients you see means the amount you get paid. And with, like insurance systems, it's, you're trying to see patients within a certain time frame, and they have to be scheduled within certain time blocks. So you have your 20 minutes, you have your 40 minutes, you have your 30 minutes, whatever time block works for you. But it doesn't sometimes allow us to spend as much time as we can with patients. In other words, if you tend to spend longer with patients, you don't get reimbursed as much. And practically speaking, you have to pay bills. And so we understand, like what the major systems are doing. And that's where, like newer models of care, whether it's concierge, whether it's direct primary care, all of these have kind of popped up as a way of kind of helping make the system better, whether it's affording time with patients, whether it's having patients have that closer connection with you. I think it's system built. So I am a hybrid practice. I do recognize that, a lot of patients are just stuck with insurance, right? That's all they have. That's what their job provides. And they need medical care. So we absolutely should be able to provide a service, and I want to do that. The leeway I have now, having my own private practice, is that I get to determine like the length of my visits, right? I get to determine how many patients I see a day. In some major systems, one doctor can see 30 patients a day, right? And of course, but sometimes we used to joke, by the time you see 30 patients a day and you get to the end of the day, you don't know which side is left, which side is right. You have to be extra careful when you're ordering, or you're writing your notes, right? So it takes into account, the wellness of the physician, the safety, in terms of practicing medicine. So all of these things, again, systems built, but it gives you some leeway with having your own private practice, in that you call the shots. So that's what I like about that. And then I also have the direct primary care arm of things that allows me to spend even more time with my patients through that model. So it works. I definitely love where I am with my private practice.
That really is the dream, right? It's like doing practicing medicine on your own terms, really. And everyone gets to benefit, because now the doctor is well, and the doctor feels in control, or is in control of how their patients are doing. And one thing I love about private practice like yours is the fact that, because it's just you, the physician, leading the charge, you are always going to be there, versus the bigger systems whereby one day, physicians are leaving, and so now patients have to switch between clinicians in the same clinic. One day they see this person, the next day it's another person, and they feel like no one really knows them, or they feel like they have to tell their story over and over again, because every 6 months they come back, it's a new doctor, and it's a new PA or a nurse practitioner or something, someone else that they've not met before.
Absolutely.
So what is your advice on how patients can, navigate this healthcare system in a way that's beneficial for them? How would you navigate it as, yeah.
So I would say, I think one of the major problems is patients like having multiple providers or physicians, not providers, physicians who don't communicate. And it's not through any fault of their own. If something is wrong, there are urgent cares. I can go to an urgent care, but my PCP, my regular doctor, doesn't really know like what's going on. Or I have all these specialists because I can get in quicker in this system versus that system. And then all the different systems aren't communicating. So if you can centralize, have one PCP or primary care doctor, and try to stick with that system, that will definitely help with navigating and getting you that optimal care that you need. Like you talked about telling your story over and over, because if you're meeting someone, everyone wants to know the background, so that they can treat you, but it'll feel like you're starting all over each time if you're going to different providers. So certainly trying to keep everything centralized will definitely help with navigating that.
Nice. Yeah, it's and yeah, I mean, fragmentation of care is a big deal. And in terms of even the geriatric population, when their care is fragmented, they tend to end up on multiple medications in the same classes. They are falling. The urologist isn't communicating with the cardiologist, and the PCP is overwhelmed with, 2,000 patients, and so it's healthcare is very fragmented, and so it's really nice when we have individuals like yourself who've stepped out of the mold and wanting to build a system where at least some people can get optimal care and feel well taken care of. So if someone lived in the Mechanicsburg area, tell them what Syndicare stands for, and share with us some of the aspirations you have for a patient that joins your practice.
Sure. So, Dr. Syndicare, like I mentioned, we are a hybrid practice. So we take insurance. We also are a direct primary care, which means we have this membership model that gives you, direct access to me, the physician, the only physician right now in the practice. You get that same or next day appointment, more personalized care. Not to say you won't get the same with the insurance, but again, insurance kind of limits what we can do there. So that's what we are. We are serving the Mechanicsburg area and surrounding areas where we were temporarily located in Wormleysburg. We'll be moving to our new building in in March. We are happily serving, busy professionals, anyone on the go. We provide, primary care. So all of your annual visits, we do weight loss. We see kids, like I said, from the cradle to the grave. So, the newborns, our pediatric patients, the adolescents, the young adults, the adult men and women, and of course our geriatric patients. So we see the full scope. We really enjoy what we do. I also have a special interest in women's health. So I do a lot of that as well. So you can get your pap smears. We talk about contraception if you want that. So happy to serve.
Yeah, it sounds like a whole spectrum of care from babies to everyone. That's really amazing. We are wrapping up to the time. Are there any things that you feel like sharing with the audience, and some practical tips? And then I'm going to end with 3 things you keep at your bedside every day, on your nightstand every day.
So absolutely. So okay. So on my nightstand every day. So I have my Bible. Since I'm in my 40s and I now can't see, I have my glasses on top of my Bible because now I need to use them to read. And usually I have a bottle of water. Because I can't see at night. But yes,
okay.
I think that's what I have there. I just say, definitely prioritize your health. I know for a lot of us who are very busy, we tend to, and if you're a mom, if you're a caretaker, we all wear different hats. You tend to put yourself on the back burner and think, that you're always going to be healthy but I think at least scheduling an annual visit, that's a gift you can give to yourself. If you do it on your birthday, just be like, that's my birthday gift to myself. Schedule, an annual visit and just make sure that, everything is okay. But I would say prevention is better than the cure. So that would be my one piece of advice.
Yeah, thank you so much for being on here. And one cool thing I learned about Dr. Ojevwe's practice, Dr. Syndicare, is that it is the #1 primary care office in the Mechanicsburg area. Trust me, I checked on AI and Google, and that's what popped up.
Yeah.
So if you are in
The
the
number
area,
the number one, direct primary care.
primary care,
The
yes.
direct in front of it. Yes, yes.
Oh, okay, yes. So the number one direct primary care in the area. So
Yeah.
if you live there and you are looking for a caring primary care physician, you are tired of waiting for months before you can see your doctor, you are tired of getting through 10 people and 10 phone calls and 10-minute waits just to speak to someone, please reach out. And I know you are taking on new patients, so reach out and schedule your annual visit with her. Where can they find you?
Sure. So right now, we are online, so you can book online through our website. It's www.drcindycare, and it's drcindycare.com. So there you can book whether you want to join the membership, which is the direct primary care arm of things, whether you want to schedule an insurance visit, whether you just want to have a consultation with me. There are all links there to that.
All right. Well, you heard her, Dr. Cindy. Thank you so much
It was my
for being here.
Thanks for having me. Bye.